though it does not eradicate this tumor and does not cure this type of tumor. There are a few cancers that we're able to eradicate with chemotherapy, but unfortunately not that many. Most cancers we're not able to get rid of with chemotherapy. And this falls into the category of one that we don't have a chemotherapy that we know to be curative or eradicative. But the hope with chemotherapy is that if it's able to contain the tumor and prevent the further spread and prevent any microscopic amounts that are there from gaining traction, and then maybe we can go back on the back end and consolidate that treatment with surgical removal of the other areas. And that's, and hope for the best. And in some cases we do, have long-term remissions from that. Occasionally, I've had people that have been cured from that, although even in that situation, I would say it's rare for it to be a permanent cure, complete remission, even after everything's gone well from that standpoint. Chemotherapy has worked initially, surgery has been successful to remove what's left. That is the best chance, but even in that case, we often see a new area develop, presumably from some microscopic amounts of seeds that are out there even after that. But so far the trajectory has been positive in terms of the effects of the treatment, in the sense that whereas before you were on treatment, you were developing new tumors over a period of months, or at least new tumors were becoming apparent, were taking and growing to the point that we could detect them on a scan, is how I would phrase that. Now we've seen a lack of that continuing. In other words, no new areas growing and developing of what probably would have if we had not been on therapy. And the existing ones have shown a slight, minor, regression compared to where they were before, but pretty minor, frankly. It's if you look at the before and after pictures, they're almost identical, with the kind of existing tumors perhaps decreasing by like a millimeter, tiny amount. So I think that taken in whole, I believe that the chemotherapy has had a positive effect at stunting further growth and spread of the tumor, but it hasn't gotten rid of the existing ones. And so the question is what to do next. The fact that we've been able to prevent the growth and spread of further ones, it is encouraging, I think, to start thinking about the idea of using surgery to try to remove the what's left from the ones that are there before we got started. And really the more nuanced question, and one that I don't frankly have a perfect answer to, is is there utility to doing more chemotherapy even before we go into that, to try to let's say maximize the effectiveness of this chemotherapy? That's a tougher question, because we don't really have a lot of testing to show what's sort of the incremental benefit to adding more and more and more chemotherapy on when we've had some initial stability like this. Historically, when people have been dealing with this type of aggressive cancers, the thought was to give as much chemotherapy as the body could tolerate, which for this variety of chemotherapy tends to be 6 rounds of it, not twice as much as you received, to ideally maximize the effectiveness of it. On the other hand, there's been a bit of a trend to say that the most important part of chemotherapy is the first few rounds, and adding on 3 additional rounds or additional chemotherapy after you've had some initial stability doesn't really seem to add very much to the effectiveness overall, or improve the odds, let's say, of things not developing in the future. Unless you see a very pronounced effect of the chemotherapy, a very dramatic, regression, or or for certain cancers where the chemotherapy is particularly sensitive to. And so, taken in whole, I think that this has been a good initial response, but I do think in your case this is time that we've achieved the goal of chemotherapy, which is to prevent the initial spread and create initial stability, so that we do have more of a confidence in going in to try to remove what's left, and have more confidence that it's not a given that after that is done that something's going to develop right away anyways. And so I think it is time to start thinking about the surgical part of it, which we have, at some point, been strong considering the first step. But I think now it would be the kind of time to go back and revisit that after a little bit of further recovery from the chemotherapy, which you're still feeling effects of, obviously. You wouldn't go to surgery for several weeks at least until your body's more ready for that recovery.
How many places does she have? I mean, tumors?
Well, there's 3 tumors in the lung that are measurable and that are...
Can you bring up the scans?
Yeah, I can show you the scans, yeah.
So what would surgery
They would have to do
entail?
a stage surgery where they would first do, because it's on two sides of the lung, where they first want to go and remove the largest tumor, which is on the right hand side.
Is there still some on the left that
And then there's
is
two
determined to be?
There's two on the left hand side that I am confident are the tumor as well. And
Why?
these are the ones that had, I would say, developed as initial planning was undergoing, and the reason, seeing those having developed is the reason to, I would say, put the hold on just going to surgery right away, and rather switching to this strategy to go into chemotherapy, because again, of the pattern showing this initial development, meaning that likely additional ones would have developed had we not, done that. Let me show you what I mean here. This is it's not exactly. Can you see this? So these are, what I was looking at right before I came in the room with you. This is your current scan from yesterday. This is the most recent comparison. This is the CT portion of the PET CT scan that you had done right before you started treatment. All right. And so to orient you, and please feel free to come around if it's easier to see. I just want to make sure that you're able to see it.
Yeah.
To orient you, the lungs are the black part. This is like your muscles and stuff on the outside, and your bones in the back, and your heart in the middle.
Oh.
So what we're worried about, or what we've been tracking, is this right here. That's a tumor that's in the middle of the lung. That's the biggest one. That's on the right side.
Mm-hmm.
That'll be the one that they remove first. If you just put measurements on it, it's approximately the same. Like I said, if anything, it may be a hair regression. On the left side, there's this one that you can see the radiologist measured there, which was there before. It measures slightly smaller than before again, but by like a millimeter. Not very dramatic. And then again, on the left side, kind of nearby the other one. It's a little more subtle because it looks more like the normal lung markings. So a lot of these things, like these white areas in the lung like this, is actually what the normal lung would look like. These are either airways or blood vessels in the lung.
Mm-hmm.
And so if things are small enough, they're a little harder to distinguish from sort of the normal markings, but clearly a circular, solid appearing mass like that is abnormal in the lung, and that's what a tumor would look like. On this one, you can see a little bit more clearly on the previous pictures, see there. On the current one, that one, for whatever reason, the smallest one had a little bit more of a regression than the others. It's a little bit harder to see on this one, but you can see they kind of measured it there. And there. So those are the three that we were